Welcome back to Living Pain Free with Dr. Marc Darrow. We're taking your calls right here in the studio at 866-870-5752. And right now we are speaking with Vincent about his hip issue. Dr. Darrow, should I talk about the website?
Yeah, go ahead.
And our website is www.jointrehab.com. That's jointrehab.com. You can email Dr. Darrow off of every page on the site, and you can also see him doing
put me through,
these
please.
treatments on videos. So if you are new to the show or new to the concept of regenerative medicine, then please go to the website. Again, that's jointrehab.com, and watch those videos and you'll get a sense of what this is all about. And it's an alternative to elective surgeries. Dr. Darrow.
Yes.
What do you think? We are talking to Vincent, and I was just plugging the website and the videos you've done. A lot of great stuff on that site.
Well, I love it. I work on that website every day of my life, and we increase it with new studies all the time. It's extremely informative how to avoid an unnecessary orthopedic surgery and heal by just simple injections of platelets from your blood or stem cells in order to stimulate new tissue growth and rejuvenate the area. This new form of medicine is called regenerative medicine. It's one of the hottest topics in orthopedics. And unfortunately, our orthopedic buddies are the last on the bus. I don't know why it is, the culture they have, and I'm not putting them down. I love orthopedic surgeries. They do the hardest work in medicine, but it's done a lot of times when it isn't needed, and that's just my humble opinion. I'm sorry if I'm tweaking anybody's feelers. That's not my intention. It's just my experience. I've been doing this work over 25 years and healing necks, backs, arthritis, shoulder tears, rotator cuff tears, labral tears, hips, knees, fingers, toes, hamstring tears, the muscles in the back of the legs, calf tears, tendon tears, ligament tears, you name it, anywhere in the body. So, Vincent, you're still with us?
Hi, Vincent. Are you with us?
Well, let's go to Robert. Dr. Marc Darrow. Robert, you've got lower cervical and you've had stem cells injected in your low back. What's your main issue today?
Hi. Just want to make sure, doctor, can you hear me?
Yes.
Yeah, go ahead. Go for it.
Yeah, so I got it. So I got it in my lower neck. So about a couple years ago or a year and a half ago, I developed a really bad pinched nerve on the left side of my lower neck. Mm-hmm. And it was really bad. It got really worse when I went out and played basketball. I jumped the wrong way for a rebound, and then my whole left arm basically went numb. And I went to get an MRI, and of course they wanted to replace 2 of my discs with metal plates. They wanted to do that surgery. And so I decided not to do that, and then I just started doing a bunch of different therapies, acupuncture. Chiropractic didn't really help because my neck was just so tight and inflamed. But I did go get stem cells around mid-March, late March of this year. They did 1 neck epidural with the stem cells, and they also did, the regular IV. Now, here's the thing. So I'm, this about 5 months later, right? I do feel a little bit better. But the pinched nerve is still there, right? So what I'm calling to ask is just, to understand this a little bit better. Do you think that the stem cells can, I don't think I had like a rupture of the disc, but I definitely have severe herniation of the disc and severe arthritis because they did the MRI and very small narrowing of that hole in your vertebrae, that the foramen. Excuse me if I'm getting the terms wrong.
No, the term is right. It's called the foramen. The foramen just means an opening. You're right.
Right. And so, the stem cells can't fix that, right? What it's doing, and I do feel a little bit better, right?
It's like I have to tell everybody else, Robert, until I touch your neck or whatever area it is, I can't tell you a darn thing.
Right.
I don't want to second guess what's going on.
For sure. Well, do you think?
And it may just be that your neck needs to be stabilized. And maybe your neck needs the ligaments to be stabilized so that that nerve isn't getting moved around by loose ligaments in the neck. So yes, stem cells may be the answer, but I can't tell you that without touching it. If you want to call the office, you can call it 800-300-9300 and talk to people there right now. And if they have a problem getting you in, if you need an appointment, you can just email me through the website, and I'll get you in whenever you need to. The number to the website is www.jointrehab.com. It's www.jointrehab.com. If you do that after the show, I'll get your email from there. I have a spot on every page to email me, and you'll find on my website there's going to be videos of me injecting necks and other parts of the body, and you can see if it's something you think is good for you or not. And
Can I ask you what's your general opinion? Because I've heard the show, and most of the time you guys are talking about backs and knees and shoulders.
Yes.
What is your opinion
Yes.
on stem cell therapy in lower necks for herniated discs?
I do it all over the body. There's no part of the body I don't inject. I mean, for the musculoskeletal system. But again, it's not a carte blanche. It's not like you have a problem in your musculoskeletal system, orthopedic issue, and I'm going to tell you go do stem cells or platelets or whatever, because I don't know until I touch it. You've got to be examined, moved around, palpated, that means touched, to elicit where the pain is coming from. I'll be able to tell you in 1 minute if I can help you or not once I touch you.
Now, 6 months later, I am feeling better. Do stem cells work 6 months after they've been injected? Because I read
Not really. No, not really. Not in the way you're thinking. So you have what we call a radiculopathy. That means that the radix of the nerve that goes through that foramen you're talking about gets tweaked once in a while. And 94% of those go away without a doctor. So you could say, well, I had stem cells and it went away. And I'm going to say, nah, probably not. Not if it happened 6 months later. If it happened, right then with the injections or within a week or something, then I'd say, yeah, that was the stem cells. But that's too far out to think that was, what happened.
Okay. Well, I feel like it did help me, at least with some inflammation I felt afterwards. I felt that died down. So I definitely got that maybe.
Yeah, you got the benefit of, and that's something that's more local, not the radiculopathy, not the nerve being pinched. That's just, local neck pain, central neck pain. That's different. That's a different animal. You can have neck pain and still have a radiculopathy down your arm, numbness, paresthesias, tingling, weakness. Or you could have neck pain without that, or you could have the reverse and just have the radiculopathy without the neck pain. So you need a doctor to touch it, show you what's going on, and I'd love to see you. If you want to come into the office, call 800-300-9300 and get to the bottom of this for you.
For sure, I will do that. I'm going to leave you with one question. What's your opinion
Sure.
on the surgery, putting the metal plates in the neck? When people do have pinched nerves, I had the neurosurgeon trying to talk me into it, saying, "Oh, this will be great," But I've had other people say that surgery actually, made them feel worse in other ways. So I'll hang up and listen to your answer about what you think about surgery.
No, stick around. Stick around. I want you there because I want you to hear this, and then you can respond. So, in my experience over probably 30 years in medicine, spine surgeries often come out terrible. Terrible, terrible, terrible. Do some come out great? Yes. Are you a gambler? Do you like Las Vegas?
No, I don't like to gamble, actually.
Yeah, well, I don't either. I detest gambling. So that would be a surgery that I wouldn't want to put on anybody. I know some people get better for a while, but I know way too many more people who have travesties afterwards. And I talk to my patients and I go, please don't do that surgery. They go, no, I want to fix it. I don't think that regenerative medicine, stem cells and platelets can fix it. And I go, you're taking a big risk. If I do injections, at least it's conservative. If it doesn't work, You can always do a surgery later. But if your surgery bombs out, which happened to my shoulder, thank God it wasn't my neck. When it's the neck, it's really problematic. If it's in the spine and a surgery fails, it's really bad. And I have to tell you this, and I don't want to slime you with bad information, but you have to know this. There is a diagnosis that's called failed neck surgery. That means that there are so many of these that fail that the insurance company has a diagnostic code for it. So people go, or the doctors go, there's only a 3% chance of failure. If you're one of that 3%, that's 100% for you.
Yeah.
And I see calamities, absolute calamities. One surgery, then another surgery, and then spinal pumps, pain pumps and nerve pumps, not pumps, but nerve stimulators, heavy narcotics, all from surgery. The person wasn't perfect beforehand, but afterwards they can be horrible. So it's just a risk. And if you're the guy who likes Las Vegas, go take the risk. I don't like Las Vegas. I hope I never put one foot in Las Vegas again. It's just not my kind of thing. Everybody's different. That's just me.
I agree.
Any other questions,
I'm glad I didn't do the
Robert?
surgery. I am getting better. So, with or without the stem cells, I'm glad I put it off and just trying to work it out.
Yeah, and we have patients coming every day, and usually on the radio show, there's people that call in. They haven't today yet, and say, "Yeah, I was told I needed surgery 10 years ago, and I didn't do it, and I'm fine today."
Mm-hmm.
So, like I said, 94% of those radiculopathies, according to the studies I've read, go away without a doctor.
Right.
Other countries, they don't operate on things like this. They go home and it's going to go away. We're just very knife prone in this country.
Yeah.
People say we have too many guns. I think we have too many knives called scalpels. That's just
a lot
me.
of people aren't prepared for the longer road of recovery. They want something that's a quick fix, and it ends up becoming more problematic.
And I'll be honest with you. Many years ago, when I was a resident at UCLA, I had a radiculopathy down my left leg, and it was on fire. And I was limping in the hospital I'd actually be leaning on the wall from patient to patient. And I didn't tell anybody anything. And I was thinking of getting surgery. It was so miserable. I wanted the quick fix. I didn't do it. I got some injections from my buddy on my back, and it healed up. So that's just the way it is, man. Too many surgeries being done for the wrong reasons.
Yeah. Well, thank you for your advice. I'll contact your office and see if I can continue improving this this condition. But
excellent.
Thanks a lot.
And I want to give a caveat. I love surgeons. I honestly do. I think they do great work. I just think that a lot of these surgeries should not be done. You got to cherry pick your patients. There are cases when a surgery really is needed, but I'll tell you one case I just thought of. I had a gentleman come in who had a 10 millimeter, that's like 1 centimeter, that's like half an inch, pretty big. Disc herniation, extrusion, meaning it actually broke off and it was in the spinal column against the spinal cord. And I think it was his right leg, if I remember correctly, that was dead. And he said, I went to several surgeons. They all want to take out that disc, but I don't want to get the surgery. And I said, okay, well, let's work on it. We did. And he got better. And he said, can I swim? And I said, well, let's let it heal for a while. And he goes, but swimming's the only thing that makes the pain go away. And I go, then swim. So everything went against traditional medicine with him, but he got better by doing it his way. He never had that surgery, and to this day, which is probably 15 years later, he's fine.
Good to know. Good to know.
Anyway, Robert, God bless
Thanks
you.
a lot,
I appreciate it.
Thank you.
Appreciate your call. Yeah, thank
Thanks
you.
for your call, Robert.
So I'm going to give out a little information here if you want to call and talk to me right now live. The phone number to the studio is 866-870-5752. That's 866-870-5752. If you want to call the office and get more information, the number there is 800-300-9300. That's 800-300-9300. And if you want to watch me do these procedures, the website, which has a lot of videos on it, is www.jointrehab.com. That's www.jointrehab.com. A couple other things. We do these procedures on the face. And you go, what? Why would you do it on the face? There's no pain. Because it grows back the collagen and makes people look younger. So it's not fake. It actually regrows the tissue on the face. On the top of the head, if your hair is thinning, it can actually thicken up the hair. It can stimulate the hair follicles to rejuvenate and get you a healthier head of hair. If you're completely bald, like some people I know, it's not going to work. You'll get some strands, but not enough. So, Nito, where are we going from here? Should I take some questions?
Well, let me just mention the website again for people that may have tuned in late. It's www.jointrehab.com. That's jointrehab.com. You can email Dr. Darrow off of every page on the site, and you can see him performing these treatments on videos, which is very helpful if it's a new paradigm for you.
It's pretty amazing stuff.
Absolutely.
Pretty simple. You know what I like about it? You walk in the office, get an injection or several if you need it, and walk out. I'm going to go to a question about knee pain. I don't think we've had a knee yet today.
Oh, good idea.
So, yeah. We actually probably get more knees than anything else, but still tons and tons of every other body part. Do tons of hips and shoulders and fingers and elbows and necks and backs and ankles and muscle tears, you name it. All right, so this person says, my mom is 90 years old and still active. Yay. She has had some knee pain and x-ray was taken. They discovered that she has bone on bone. Does your practice deal with this issue? I love when I hear this from doctors. You've got bone on bone. You need surgery. Nonsense. Nonsense, nonsense, nonsense. If a person has bone on bone, there's no cartilage, and those bones are not going to move. Okay? That joint will be locked up. So that leg will not, that knee will not bend. And from what this person is saying, their mom is having some knee pain, but not a big deal. So don't get snookered in by the term bone on bone. I rarely ever see someone with bone on bone. If they do have bone on bone, can stem cells and platelets help? They still can help. Don't get snookered by the terminology of medicine that is used in the culture of surgery. Okay? The old paradigm in medicine is medication and operation. Stay away from those if you can help it. I try to get people off of their medications and use natural supplements when possible. Many people are taking medicines they do not need. And there's lots of side effects. You may not get them right away. You may get them later. So I'm a proponent of natural medicine, and using platelets and stem cells is natural medicine. You're taking natural cells from your body and injecting it to stimulate your body to rejuvenate, to regrow tissue and heal. So I have to examine your mom, even though she's got some pain. Sounds like she's doing okay, and find out where the pain in that knee is coming from. It may not actually even be in the knee. A lot of people come in and they have a hamstring attachment to the back side of their knee, and they go, my knee hurts. Well, it is kind of the knee, but it's not the knee joint. And that's a real easy fix in most cases. I use the ultrasound. The first thing I do with the knee patient is I look inside, see if they have any fluid, look and see if they have meniscal tears, things of that nature, and then we can decide on a plan of action. So I love the work I do, and I've been doing it for over 25 years. I'm busy all day, every day with it. And to my wife's chagrin, I don't like taking vacations. I like the work I do. I know, I'm one of those guys. I just love what I do. There's nothing more fulfilling than seeing patients heal, and especially seeing them heal without an invasive surgery. So let's see what else here.
And the phone number is?
Call me live. We got a few more minutes left in the show. The number here is 866-870-5752. Call me at the studio right now, 866-870-5752. If you want to call the office, talk to my staff, the number there is 800-300-9300. I'm talking so fast, I'm getting a frog in my throat.
Well, that office number again is 800-300-9300, 800-300-9300.
Thanks, Nita.
You're welcome.
So another question. Let's see here. Failed knee, blah, blah, blah. Okay, here's one. Foot, ankle, and back pain. Woo. That's ripe pickings there. From a fall. Foot, ankle, and back pain from a fall. Gosh, that happened to me about, it's been like 6 weeks ago, I think. I think I told this story on the radio before. It was a Friday afternoon. I'd been in the office all week long, long hours, and the sun was going down. I was driving home. I live up in the mountains over the ocean, and I'm thinking, I got to get some fresh air. So I parked down at the beach. I throw on my running shoes, and I am walking on the beach, and it's high tide then, so that means not a lot of room to walk. And there's rocks on one side next to the freeway, or Pacific Coast Highway, I should say. And the other side is the water, the ocean. And there were small waves. And I'm just walking along feeling, the wonderful negative ions in the air from the water splashing, feeling amazing, cleaning out all the work I had done for the week. And I love the ocean. And all of a sudden, a wave comes out of nowhere. We call those a rogue wave. And I've had them when I'm surfing. This is the first time I've ever had it happen to me while I'm walking on the beach. And it trounced me, and I fell on the rocks.
Ouch.
And I hit my left greater trochanter. I scraped off my left forearm, scraped off my left shoulder, and my right calf, and my jaw. I hit all of those things smack at one time. And I'm laying there. My hand got jabbed in a couple places by rock. And I'm laying there going, what do I do? Do I have fractures? Am I broken? Can I get up? You ever been in that spot, Nita?
Oh, yeah.
Yeah. You don't know what to do. So you move slow. I started moving slowly. I was eventually able to get up. And I hiked back to the car, which was maybe half a mile away. And, I'm all wet and I got sand all over. I pull a towel out to wipe off some of the blood. And I look in my pocket for my glasses and they're not there.
Ouch. Oh, no.
I keep my glasses in my what do you call it, my breast pocket. And I'm like, oh no, I've got to walk back there and try to find them. I'm dripping blood and terrified and in pain.
Oh, no.
So this is so funny. I'm walking back and there's a lifeguard there, a young dude, and I go, can you please help me? I just fell on the rocks and I left my glasses, blah, blah, blah. And he goes, well, I don't know what to do.
Oh, no.
He looked like a surf dude. And he goes, I'll walk back with you, but I don't have my kit with me or anything, my first aid kit. So
Oops, there's our music.
What's that?
There's our music. It's time for us to say goodbye.
Anyway, you want to get a hold of my office and talk live to someone there, 800-300-9300. Go to the website, watch videos, www.jointrehab.com. God bless you all, and thank you, Nita and staff.
Thank you, JJ. Thank you, Suzette. I'm Nita Valens. We'll see you next time.
You've been listening to Living Pain Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain Free with Dr. Marc Darrow is heard Saturdays at 10 a.m. and 1 p.m. and Sundays at 5 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life. Call to schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.